now. So Fast Coder 21's pre-medical coding YouTube live CPC certification prep session 34 on July 23rd, 2 p.m. IST. Topic cardiovascular system CPT coding. So first question of the day here. So now it is 2:40. I will give you 5 minutes. So we will discuss the answer at 2:45. So go ahead and write your answer. Yeah, good Anita. Sorry. Yeah, Sarika. So Manikanta, Lucky, try to answer. Anita, try to answer this one. So if you don't know, no problem. So I will explain you. Yeah, thank you, Anita. So we will discuss the answer now. Anyway, few people are there. So the patient is a 67-year-old gentleman with metastatic colon cancer recently operated on for a brain metastasis. Now for placement of infuse a port for continued chemotherapy. So basically we will make so infuse a port continued chemotherapy as a keyword now. Okay. Now he is going to tell the procedure. The left subclavian vein. So whenever you see subclavian vein, you need to think that it is a central procedure. Like we have central vascular system and peripheral vascular system. So subclavian vein comes under central vein, located with the needle and guide wire was placed. This was confirmed to be in the proper position fluoroscopically. So here physician has used fluoroscopy also in order to place properly. A transverse incision was made just inferior to this and a subcutaneous pocket created just inferior to this. After tunneling, so here tunneling is the keyword you need to remember. And here pocket is also keyword you need to remember. The introduced over placed over the guide wire and the power port line was. So this is also one keyword. Port placement is also one keyword. With the introducer and the introducer was peeled away. The tip was placed in the appropriate position under fluoroscopic guidance and the catheter trimmed to the appropriate length and secured to the power port device. The locking mechanism was fully engaged. The port was placed in the subcutaneous pockets and everything sat very nicely fluoroscopically. Okay guys, so we will check one by one. So first we will check 36556. What is 36556? So insertion of non-tunnel centrally inserted central venous catheter. But and 3656 is age 5 years or older. So but basically based on our operating report, it is a tunnel procedure. See here after tunneling. But 36556 is non-tunnel procedure. So we can eliminate 36556. So which is A. So we will check 36558 now. So 3658 is the correct one as insertion of tunneled centrally inserted central venous catheter without subcutaneous port or pump younger than 5 years age. And B is insertion of tunneled centrally inserted central venous catheter is 5 years or older. So we will check remaining 36561. So Y means 556 is it is non-tunnel. 558 is it is without port or pump. We will check 36571. So what is 36571? Insertion of peripherally inserted. But as we have discussed previously, so whenever you see subclavian vein, you need to think that it is a central procedure, not peripheral vascular procedure. It is a central venous procedure. So we need to eliminate 36571 also. So we are left with 36561, which is insertion of tunnel centrally inserted central venous access device with subcutaneous port age 5 years or older. So here our answer is C 36561 770 126. As here physician used fluoroscopy, we need to append fluoroscopy. So question number 2 please. So now it is 1448. We will discuss the answer at 1454. So we need to check the keywords properly in order to code properly. So first to try to find the keywords, then choose your answer. So, if you don't know, no worries. I will try to explain. So we have 2 more minutes left. If you want to answer, you have 2 more minutes. Yeah, thank you, Nidra. So mostly we got all the answers, so we will discuss now. So a CT scan identified moderate sized right pleural effusion in a 50-year-old male. So basically pleural effusion means it is fluid in the lungs. Effusion means fluid. So pleural means pleural space which is the part of lung. This was estimated to be 800 cc in size and had been an appearance of fluid on the CT scan. As we discussed, effusion and fluid both are same. A needle is used to puncture through the chest tissues and enter the pleural cavity to insert a guide wire under ultrasound guidance. A pictile catheter is then inserted at the length of the guide wire and secured by stitches. The catheter will remain in the chest and is connected to drainage system to drain the accumulated fluid. So we need to go by now. So first we will check 32550. So insertion of indwelling tunneled pleural catheter with cup. Okay. We will check 32555. Thoracentesis, needle or catheter. Thoracentesis, needle or catheter, aspiration of the pleural space without imaging guidance with imaging guidance. So 32555 is wrong. So what is going on here? Physician is placing the catheter. See, if you check 32555, there is no word catheter. Needle or catheter, aspiration of the pleural space without imaging guidance, but it is thoracentesis. So just the physician did not mention any thoracentesis here. So 32555 is wrong. So we will check 556. Pleural drainage percutaneous with insertion of indwelling catheter without imaging guidance. So anyway we have imaging guidance. 32556 is also wrong. So we will check 32557. Pleural drainage percutaneous with insertion of indwelling catheter with imaging guidance 32557. So basically here the thing is that drainage of fluid from the pleural cavity was performed by a needle approach. So it is a percutaneous process as all of us know with insertion of indwelling catheter to drain the fluid. So we need to eliminate here B and D. 32550. What is the 32 insertion of indwelling tunnel pleural catheter with cup. So we need to eliminate 32550 and 32555. Yeah, correct. Next, we need to eliminate 32556. Here our answer is A 32557. See there, pleural drainage percutaneous with insertion of indwelling catheter with imaging guidance. If you check the code description of 32557, it looks or resembles our procedure performed. So basically, thoracentesis and pleural drainage both are different, and our code description contains percutaneous needle. So whenever you see the documentation like using the physician using the needle, you need to understand that it is a percutaneous procedure. So here our answer is A, 32557. Hi Kajit. So here our answer is A, as physician has used the needle in order to go into the pleural cavity. So whenever you see in the documentation needle, you need to understand that it's a like percutaneous procedure. So if you check code description of 32557, pleural drainage percutaneous with insertion of indwelling catheter with imaging guidance. So 32557 is the correct answer. So what is 32555? Yeah, the most of the people wrote that one. So it is not percutaneous procedure. Thoracentesis means basically it is like aspiration by making the incision here. But in our operative report, physician did not make any incision. Nah? So that's why 32555 is wrong. 32557 is the correct answer. So you need to remember whenever you see needle, you need to think that it is a percutaneous procedure. Okay, guys? Got it? Any doubt? So in order to code 32555, physician needs to create one incision. But as per the operative report, there is no incision. Physician has used only a needle. So one logic is that whenever you see the needle word, you need to think that it is a percutaneous procedure, not open procedure. So here our answer is A, 32557, not B, as B is a open procedure, A is a percutaneous procedure. As per our documentation, physician has used the needle to puncture. Usually during the percutaneous procedures, physician will use needle to puncture the tissues. So our answer is A here. Okay. So all of you understand, you need to check the documentation. 32555 is for open procedure, 32557 is for percutaneous procedure. So here physician has performed like percutaneous procedure, we need to code 32557. If the physician creates any or he mentions like I have created one incision and I have kept it one needle like that, we can code open procedure. But it is not a open procedure, it is a percutaneous procedure. Okay guys, we will go ahead with third question. One second, I will make it down. Yeah, go ahead and check this one. So now it is 1458. We will check the answer at 13.3. Sorry, 15.3. So you need to check the documentation whether physician has performed the incision or not. If the physician performs incision, it is an open procedure and the physician will dissect the tissue in order to enter into the field wherever there is a disease. But in our scenario, in that scenario, there is no mentioning of incision. So it is a percutaneous procedure. So you have 2 more minutes to answer this one. Yeah, thank you, Sarika. So we'll discuss the answer now. No worries. So the patient is a 59-year-old white male who underwent carotid endarterectomy. Okay, for symptomatic left carotid stenosis a year ago. So 1 year back he had carotid endarterectomy. So a carotid CT angiogram showed a recurrent 90% left internal carotid artery stenosis extending it to the common carotid artery. So basically recurrent means again. So previously 1 year back patient had the surgery endarterectomy. So hi Pragati. So again patient has stenosis of the carotid artery. 90% stenosis means it is more severe. So extending into the common carotid artery. He is taken to the operating room for redo left carotid endarterectomy. Redo means physician will perform the same procedure again. So previously patient has 1 year back endarterectomy. Again physician is performing the again endarterectomy. So that's why here physician mentioned redo. Redo means again second time procedure. So the left neck was prepped and the previous incision was carefully reopened. Using sharp dissection, the common carotid artery and its branches were dissected free. The patient was systematically heparinized and after a few minutes, clamps were applied to the common carotid artery and its branches. A longitudinal arteriotomy was carried out with findings of extensive layering of intimal hyperplasia with no evidence of current recurrent atherosclerosis. A celastic balloon tip shunt was inserted first proximally and then distally with restoration of flow. Several layers of intima were removed and the endarterectomized surface irrigated with heparinized saline. An oval diacron patch was then sewn into place with running 6-proline, which CPT codes are reported. So basically, it is a like recurrent procedure. So initially, patient has procedure or endarterectomy 1 year ago. Again, patient came for endarterectomy. So previous procedure did not clear patient's problems. So again, patient is came in for recurrent endarterectomy or again redo procedure. So here we need to check what is the first code here 35301. So thromboendarterectomy including patch graft if performed carotid vertebral subclavian by neck incision. Yeah, correct. So this is the correct. See here the left neck was prepped and the previous incision. So it is we will consider it as a neck incision. So and we need to check which artery. So if you check 35301 we have carotid artery. So here we have problem with carotid artery only. So we need to check 35301. And 35308 is wrong. Why means it is for endarterectomy for superficial femoral artery. And 35311, what is that? It is for subclavian artery. So based on our documentation, physician performed endarterectomy for carotid artery. We need to code B 35301 35390 as it is a redo procedure. So already physician performed this one. Again physician performing the endarterectomy. So we need to code 35390 also along with 35301. So what is 35390? Yeah, reoperation carotid thromboendarterectomy more than 1 month after the original operation. So in our scenario, patient has endarterectomy 1 year back. So we can code this one. Reoperation carotid thromboendarterectomy more than 1 month after original operation. So here we need to code 35390 also along with 35301. So Anita, you need to check this one. Yeah, 35301 is correct only, but the thing is that we need to append 35390 also, as 3590390 is for repeat carotid endarterectomy add-on code. So we need to code that also. Yeah, go ahead and solve this one, fourth one. So now it is 15.6. We will discuss this at 15.10. Yeah, no problem, Anita. So that is the thing we need to check while coding. No problem. You need to learn and you need to remember for next time. So you have 2 more minutes to answer this. Just try to find the keywords first, then you can code. Yeah, you have 1 more minute. If you don't know, no problem, but try to answer. But you don't do like this in the CPC exam. Just you need to choose with your sixth sense. So don't keep any question and answer idle or without any answer. Just try to attempt that one. Here it is no problem, but in CPC exam you need to write anything. So don't do the empty answer. So we will check our answer. So 79-year-old male with symptomatic bradycardia and syncope is taken to the operating suite where the insertion of DDD pacemaker. So here physician is performing the pacemaker insertion. Okay. After anesthesiologist provided moderate sedation, a cardiologist performed a left subclavian vein puncture was carried out. A guide wire was passed through the needle and the needle was withdrawn. A second subclavian venipuncture was performed. A second guide wire was passed over the second needle was withdrawn. A oblique incision in the deltopectoral area incorporating the wire exit site. A subcutaneous pocket was created with the cautery and the pectoralis fascia. One second. Oh yeah. Okay. Cautery and the pectoral fascia. An introducer dilator was passed over the first wire and the wire and dilator were withdrawn. A ventricular lead was passed through the introducer and the introducer was broken away in the routine fashion. A second introducer dilator was passed over the second guide wire and the wire and dilator were withdrawn. An atrial lead was passed through the introducer and the introducer was broken away in the routine fashion. Each of the leads were sutured down to the chest wall with OK. So what is going on here? Basically, physician is inserting the like dual chamber pacemaker. See here a second. It is a dual chamber pacemaker, and he is attaching the leads. See, each leads were sutured down to the chest wall. So we will check the our options here. What is 33226? So we will check 208 first. So 33208 is insertion of new or replacement of permanent pacemaker with transvenous electrode, atrial and ventricular. In our scenario, physician performed like lead position in the atria and ventricular. So here 33208 is the correct answer. Why means here physician has did the lead procedure in atrium and ventricle. So A is the correct answer. We will check B. Why B is incorrect. What is B? 33212? Insertion of pacemaker pulse generator only with existing single lead. So Anita, here there is no existing pacemaker here. So that's why 33212 is wrong. A is the correct answer. Initial placement of pacemaker. So basically this is the initial placement of the pacemaker. So we need to quote A is the correct answer 33208. You got it, Anita? And we will check 33226 also. So 33226 is repositioning a previously implanted cardiac venous system. So it is not repositioning even. So it is the initial implantation of pacemaker to the patient. So our answer is 33208 here. You got it, Anita? This one? If you have any doubt. So is the correct answer as it is a initial placement of pacemaker. Okay, guys, we will go ahead with fifth question. So now it is 314. We will discuss the answer at 320. Yeah, no worries, Anta. Try to remember that. So just we need to analyze the operative report. What is the procedure performing by the physician? Based on that, we need to code. Yeah, no problem, Anita. Just try to remember the keywords. Yeah, no problem. Leave it to that one. Just to try to attempt this question number 5 now. So you have 2 more minutes, I think. Yeah, thank you, Sarika. Yeah, thank you, Pragati. So you have 1 more minute left. So we will discuss the answer. So go ahead, we will check. So patient has lung cancer in his upper right and middle lobes. Okay, cool. Patient is in the operating suite to have a video assisted thoracoscopic surgery. So it is like whenever you see scopy, you need to think that it is an endoscopic procedure. So a 10 mm 0 degree thoracoscope is inserted in the right pleural cavity through a port side placed in the ninth and 7th intercostal spaces. Okay. Lung was deflated. The tumor is in the right pleural. Both lobes were removed thoracoscopically. Port side closed. A chest tube was placed to suction and patient was into okay. So we will check one by one. What is 32482? So 32482. So basically 32482 removal of lung other than pneumonectomy single lobe, two lobes. So here based on the documentation it is endoscopy procedure. Okay. See thoracoscopy means it is endoscopy procedure. So because of that reason we can eliminate A and B. So yes 482 and 484 are open procedures. So we will check 32670. 670 with removal of two lobes with removal of lung. So basically we will code 3671 when physician removes the whole lung, complete lung. But based on documentation, physician has removed only two lobes. So that we can code here 32670 with removal of two lobes. It is a bilobectomy. So C is the correct answer. So everyone did the good job. Yeah, next question. Try to answer. Now it is 1519. We will discuss the answer at 1523. So now we are checking sixth question. So we have 1 more minute. So time over now. So we will check. So here we are not checking any CPT codes. Using the modifiers, we will find this answer. So the patient is a 58-year-old male, 1 month status port pneumonectomy. Okay, so lung removed. He had a post pneumonectomy empyema treated with tunneled cuff pleural catheter which has been draining the cavity for 1 month with clear drainage. So there is no problem basically. So he has had no evidence of block or pleural fistula. Therefore, a planned return to surgery results in the removal of catheter. So basically, it is a planned procedure. So planned means it is a staged procedure. So that as it is a planned procedure, we need to use the 58 modifier. What is 78 modifier? It is repeat procedure by the same physician for related procedure. But it is not a related repeat procedure. Na? It is a staged procedure. Like planned means it is a staged procedure. See here, this is the keyword here in order to select proper answer. So before putting the catheter only, physician has decided that again I need to take the patient to the operating room and I need to remove the catheter. So it will become here we need to use 58 modifier instead of 78 or 79. So we are left with two codes here. So we will check 32035. So what is 32035? So thoracostomy with rib resection for empyema. So it is completely wrong. There is no thoracostomy here. So we will check 32552. So 32552 is removal of indwelling tunnel pleural catheter with cuff. So basically based on our operative report, our answer is D here 32552 58. D is the correct answer, Sarika. So why means it is a planned procedure which is decided by the physician before starting this procedure. So here our answer is D 32552 and 58 modifier. See here planned is the keyword. Planned return to a surgery is the keyword here. So go ahead and check question number 7. So now it is 1525. We'll check the answer at 1528. No need to worry about ICD, just to concentrate on CPT. Yeah, 78 is unplanned procedure, but here it is a planned procedure, na, Sarika. See here, a planned return to surgery means it is a staged procedure. So one stage physician thought to perform the pleural catheter insertion. In the second stage, physician thought to remove the pleural catheter. So that's why it is a staged procedure. It is planned only, even physician only mentioning na planned means. So that's why 58 is the correct answer. D is the correct answer. Yeah, correct. Pragati and Anita. So try to answer seventh one now. Oh, sorry. Yeah. Here there is no confusion, Sarika. Basically, physician only telling it's a planned procedure. So in the future, whenever you see it is, if it is a planned procedure or staged procedure, you need to add 58 modifier. So you have 1 more minute. Okay, guys, we will discuss the answer here. This 67-year-old man presented with a history of progressive shortness of breath. Okay, he has had a diagnosis of secondum atrial septal defect for several years and has had atrial fibrillation intermittently over this period of time. He was in atrial fibrillation when he came to the operating room, and with the patient cannulated and bypassed, the right atrium was then opened. Okay. A large 3 into 5 centimeter defect was noted at the fossa ovalis, and this also included a second hole in the same general area. Both of these holes were closed with a single pericardial patch. What CPT and ICD-10-CM codes are reported? So we will check. So basically here patient has atrial septal defect. So here we will eliminate A and C. So A and C are not for atrial septal defect. The surgery was only performed on the atrial septum. So we will eliminate B. So here our answer is 33641. So we will check 33641. So what is 641? Repair atrial septal defect secondum with cardiopulmonary bypass with or without patch. So based on the documentation, physician has used the patch. See here, see patch. He has used the patch. So here physician performed the repair of atrial septal defect secondum. So based on here, secondum atrial septal defect for several years. So here answer is D 33641 Q 21.1. D is the correct answer for seventh question. Yeah, D is the correct, Anita. Lucky and Anita, D is the correct answer here. You see 33647, what is that? We will check, no worries. 33647 is for repair of atrial septal defect and ventricular septal defect with direct or patch closure. So based on the documentation, physician has performed uh, only atrial septal defect. There is no ventricular defect, na. So that's why we need to code 33641. See here, atrioseptal defect. He did not mention anywhere ventricular septal defect also. So we need to code only atrial septal defect. So we will not code for ventricular septal defect. You need to understand that atrial septal defect is different, ventricular septal defect is different. So based on the operating report, physician performed procedure on only one defect, that is also on the atrial septum. So here our answer is 33641. If you check 33641, repair atrial septal defect secondum with cardiopulmonary bypass with or without patch. See here bypass also mentioned. Cannulated and on bypass means it is a cardiopulmonary bypass. But in 33647 there is no mention of bypass. Na? So here our answer is 33641 which is D. D is the correct answer. So try to answer this one. Eighth question answer, please. So now it is 3:33. We'll discuss the answer at 3:36. Eighth question answer, please. So we have 1 more minute. So here you need to code this one based on the modifiers only. Okay, the patient is a 51-year-old gentleman who has had an end-stage renal disease. Okay, he was in the OR yesterday for a revision of his AV graft. Okay, the next day the patient has complications of the graft failing. Okay, the patient was back to the operating room where an open thrombectomy was performed on both sides, getting good back bleeding, good inflow. Select the appropriate code for the procedure. So here our answer is 36831C. Yeah, 3 the correct answer. So why means here there is no planned. So previously whenever we used 58 modifier, it is a planned procedure, or otherwise you can call it as a staged procedure. But here there is no planned procedure. It is a complication because of that grafting. So here we will use 3683178. What is 78? So 78 modifier is for related procedure. So D is the correct answer here. Sorry, C is the correct answer. Yeah. Anita, C is the correct, no problem. Oh, Sarika, here A is not correct. What is A? 76 modifier. Can you check that one? So 76 modifier description. What is that? Indicate procedure service was repeated by the same physician, but there is no repetition of procedure here, Sarika. So it is a complication of the AV graft. So here basically graft is falling. The patient was back to the operating room where an open thrombectomy was performed on both sides. So it is not repeat procedure. So it is like unplanned repent to the, yeah, repeat procedure related to the original procedure. Correct. Yeah. Yeah, repeat procedure, but related to the original procedure. So here our answer is C, 3683178 modifier. If the physician performs same procedure repeatedly, we can use 76 modifier. So physician performs procedure related to initial procedure. So it is not a repeat procedure. It is a complication. So here our answer is C, 3683178. So basically we will use 78 modifier in the facility setting. Okay, so we'll conclude last question of the day. So now it is 1537. We will check the answer at 1540. So basically ninth one is very easy one. So you can code easily. Yeah, thank you, Pavan. Yeah, is the correct answer. It is a direct question, so there is no problems. So I think we have any question. Yeah, we have last question. So here is the answer 37609. So question number 10, last for the day. So now it is 1540. So we will discuss this answer at 1543. No, Lucky, what is D 37799? No, that is not correct, Lucky. That is, I think, unlisted code. What is 37799? Yeah, 37799 is unlisted procedure, vascular surgery. But we have separate code for temporal artery biopsy. So which is 37609. So if you check description of 37609, you will get the answer. So what is 37609? Ligation or biopsy temporal artery. So whether it is ligation or biopsy, we need to use the same code, which is 37609. See here, the medium size artery were dissected it out for a length of approximately 4 centimeter with some branches. The ends were ligated with forovicral and the artery was removed from its bed and sent to pathology as specimen. Whether it is a ligation, whether it is a biopsy, we need to code 37609. So A is the answer. So check this one, question number 10. So you have 2 more minutes. Lucky, what is your answer here? So you have 1 more minute to answer this one. Yeah. Okay, guys. We will check the answer here. 50-year-old female has recurrent lymphoma in the axilla. Okay. Ultrasound was used to localize the lymph node in question for needle guidance. Okay. So here ultrasound is the keyword, needle guidance is the keyword. And 11 blade scalpel was used to perform a small dermatomy. In an 18 into 10 centimeter biopens needle was advanced through the dermatotomy to the periphery of the lymph node. A total of 4 biopsy specimens were performed. Obtained. The 2 specimens placed in RPM. Okay, it's not necessary. So here basically we will eliminate 122. Basically here there is no aspiration of the fluid. We can eliminate A. So we are left with 500, 505 and 525. So if you check the documentation here, physician used ultrasound. So for us ultrasound code is 76942. So we will eliminate B as it is a fluoroscopic guidance. See here, it is ultrasound here. 76940 is for ultrasound. 77008 is for fluoroscopy. So we will eliminate A and B. We are left with C and D. So we need to check C and D. 38505. Yeah, we need to check C and D. This code description. So 505 and 525. 505 by needle superficial. 525 open deep axillary node. So basically based on our operative report, here physician mentioned needle. So here we need to take this one. See the correct answer here. 525 is the open procedure. 38505 is the percutaneous procedure. As we have discussed previously, whenever physician uses needle, it is mostly percutaneous procedure, not open procedure. So here physician has used the needle. So here our answer is 38505769426. So using the imaging guidance also you can eliminate easily. So here ultrasound was used, correct? So we will eliminate B. It is a fluoroscopic guidance. So among these two, we have one percutaneous procedure, one open procedure. So but based on documentation, physician performed percutaneous procedure. So we need to code C. 38505769422 is the correct answer. Yeah, thank you, Praveen. Yeah, C is the correct answer. So we need to master in the radiology codes also. So using the radiology codes also, you can save your time. So in this situation, see here, if you know the radiology like ultrasound and fluoroscopy radiology codes, you can eliminate easily and you can save your time. So, but here most of the people wrote to B is the correct answer. So, but to B is the wrong answer here. Why means here B includes fluoroscopy guidance. 7700T is for fluoroscopy, not for ultrasound. Yeah, C is the correct answer here. So Anita, Pavan, and yeah, Parisa anyway is correct now. Sarika is good. So no worries. So today we'll conclude our session here. So this is the last question. So I will wait for 5 more minutes. If you have any doubts, we can discuss. Yeah, no problem, Parisa. No worries. Anyway, because based on your answer, I got to know that you have good understanding of CPT. No need to worry about that. So guys, if you forget to click on like button, please click on like button. So it will motivate me. And if you click on the like button, this video reaches more people. So YouTube will share this video to more number of people if it finds more likes. So please click on like button. So I will wait for 4 more minutes. So afterwards, I will stop this session. So Sarika and Anita, just you need to concentrate on the keywords while checking the operative report, and you need to know the differences between open procedure and percutaneous procedure. So today we have two or three for open procedures, and no worries, Sarika. Thank you, Parisa. Thank you very much. No worries. So our intention is to help the coders and frankly develop myself also. So as all of us know, education is ocean. Every day we need to update our coding guidelines. So I am doing the same thing. So if I am teaching you means I am also learning. So that is my intention. So while learning, I want to teach you also. Yeah, no worries, Parisha. So are you from India or somewhere else? Parisa, Paris. Yeah, by means I have subscribers from USA also, USA and UAE and Dubai and Pakistan also. Yeah, no worries, Parisa. Always best of luck. So always yeah, no worries. UAE, yeah, great. So as I told you, I have few people used to come from USA also for these live sessions. So currently we are providing CPMA certification training to UAE people only. So we have few students, they are from UAE, so we are conducting CPMA training for them. Yeah, myself and we have one more trainer, so we both will train them. So if anyone is, as anyway you are staying in UAE, so if anyone is interested for CPMA, please let us know. Why means, welcome Pavan. Why means in UAE there is a huge value for CPMA certification, but in India there is no value. But in UAE there is huge value for CPMA certification. So most of the trainings we are providing for UAE people only. The CPMA certification. So you have 3 more minutes. After 3 minutes, we will conclude this session and we will try to meet next week. Yeah, no problem, Parisha. Because of your question and answer, I got to know that you are master in CPC. Yeah, send your mobile number to vincentmedicalcoder@gmail.com. So I will add it in the WhatsApp group. So anyone wants to join in our WhatsApp group, send your mobile number to vincentmedicalcoder@gmail.com. I will add them. No problem. Welcome. So we have 2 more minutes in order to stay here. So no problem. Everyone, best of luck. Just you need to know the differences, like what is open procedure, what is closed procedure, what is percutaneous procedure. So you need to think that whenever you see, yeah, no problem, Paris. So if you want, you can watch all our videos. So we have nearly 35 videos related to. Next week, I need to plan, Anita. I need to check my documents. I need to plan. Guys, if you have any material, just to provide it to me so that I can use those material in these sessions. So if you want, you can provide. Otherwise, so after complete of my documents, I need to stop these sessions. So if you feel something is difficult for you, just share that documents. So I need to plan, Anita, for next week. So mostly, yeah, no worries, Paris. Thank you very much. So our sessions are all like this only. So just my intention is to help the students. So if they pass, they will remember us for long time. Anyway, helping others is okay. Okay, pathology, not stuff. If you know the basic guidelines, now you can write easily. So these are the minor things you need to understand, Pavan. So like what is open procedure, what is like percutaneous procedure. So like those minor things you need to understand. And one more thing, today we have eliminated the things based on the modifiers also and based on the radiology codes also. So you need to master in modifiers as well as the radiology codes so that you can pass your exam very easily. Not what I feel, it is not tough, not easy, but you need more practice as well as the time maintenance. Okay. So what is the HCPCS book? SCPCS. So anyone wants to join? So if anyone writing this CPC exam, watch last week's video, anesthesia modifiers, which is also very important for CPC aspirants. Watch that video. I have explained everything there. So how to choose the modifier and what are the modifiers in the anesthesia coding. Try to watch that. It is very useful for you if you are planning to write CPC exam. So basically, Nandakishore, good afternoon. So basically, there is no easy way to pass. So everything depends on you. You need to know the, yeah, yeah, okay, yeah, got it. So nothing is easy. In CPC exam, mostly to see please make video on that. I mean Hickpick's books. So basically, I don't have that book, Paris. So if you have that book, just you can share with me. I will try to make a video on that. I don't have Hickpick's book. I have CPT and ICD 10 CM. I don't have Hickpick's book. So easily means you need to master in modifiers first. Then you need to master in, as today we have practiced, Based on radiology also, you can eliminate the answers. And based on the, if you take ICD-10 CM, you need to know the initial for every chapter. For example, if you take I, it relates to the cardiovascular system. Okay, if you take M, it relates to the musculoskeletal system. Like that, you need to know each and every chapter initial letter so that you can eliminate very easily. So we have plenty of videos related to CPC exam on Fastcoder 21. Please watch those videos. If you feel something is difficult for you, just please mention in the comment section. So as soon as I see, yeah, that only Anita, I don't have a Equix book. So if you have Equix book, please provide it to me so that I can make one video. Anyway, Equix, I think you will get only 4 questions. Out of 100, you will get 4 questions from Equix. So if anyone has the material, just provide to me. I will make the video on that. Okay, okay, got it. If you have soft copy, you can send it to me. So otherwise, I need to wait as soon as I will get the. Yeah, go ahead, Nandakishore. So all of you, please try to click on like button. Soft copy, Anita. Yeah, no problem. We can send it. So I will try to utilize that. Yeah, yeah, send Anita. No problem. So mostly, na, we don't have much things in changes in the HIC picks. Only we have changes in ICD-10 CM as well as the CPT. So Nandakishore, I have received your email, like your mobile number. So do you want me to add in WhatsApp group? So if anyone want them to add in the WhatsApp group, send your mobile number to provided email ID so that I can add in the WhatsApp group. So please watch our remaining videos, Nandakumar. So based on the situation, I have provided the set tips. So individually, I can't tell anything. So watch our videos based on the situation, based on the scenario. I have explained that like tips. Yeah, no worries. I will add in the WhatsApp group. Okay, guys. Take care. So we will meet next week. So watch our fast coder videos. Those are very helpful for you if you are planning to write CPC exam. Nearly we have 30 videos related to CPC exam. Watch those videos. If you don't understand anything, please let me know so that next week we will plan that. Okay guys, take care.